Assalamualaikum warahmatullahi wabarakatuh. Hi guys, how are you today? I hope you are in a good health. Before I start, let me introduce myself. My name is Maftuhatarizqoh and you can call me Iko. Okay, today I want to present about Introduction to Psycholinguistics course, and this is the mind map that I've made before, and I want to explain about language disorder. Let me give you the mind map. Okay, first, Uh, I want to explain about language disorder. What is language disorder? Language disorder or language impairment are disorder that involve the processing of linguistic information, and problems that may be experienced can involve grammar, syntax, or morphology, semantics, meaning, or other aspect of language. These problems may be receptive, involving impaired language comprehension, and expressive, involving language production or a combination of both. Language disorder can affect both spoken and written language and can also affect sign language. Typically, all forms of language will be impaired. There are two kinds of language disorder that are receptive language disorder and expressive language disorder. What is receptive language disorder? Deficits in receptive language are apparent when children do not understand language at an age appropriate level and include difficulties following directions, understanding words and sentences, and answering questions. Comprehensions of both oral and written language can be affected, and there are symptoms of receptive language disorder. What are the symptoms? The symptoms is turning out when people talk, asking people to repeat what they say, and giving answers that are off, and the last is trouble following directions. And second is expressive language disorder. What is expressive language disorder? Language disorder. Deficits in expressive language are apparent in both the formation and production of language and include weak vocabulary skills, word finding difficulties, word omissions, pronative skills, for example, storytelling, difficulty providing information, and grammatical errors. Expressive language disorder can affect both oral and written. And like receptive language disorder, expressive language disorder have symptoms too. What are the symptoms? First is being late to begin talking, speaking quietly, leaving outwards, and having about finding words. We go to the types of language disorder. There are 8 types of language disorder. The first is sensory impairments. What is the sensory impairments? Sensory impairments, there are 2 types. The first is blindness. It's link between communication skills and visual impairment with children who are blind is currently being investigated. It impairs one's speech ability. One cannot recognize gestures and facial expression. And the second is deafness or frequent ear infections. Is the trouble with hearing during language acquisitions may lead to spoken language problems. Children who suffer from frequent ear infections may temporarily develop problems pronouncing words correctly. Second of the types of language disorder is apraxia. What is apraxia? Apraxia is caused by disease or brain damage. The brain cannot make and convey correct of apraxia affects convey correct movement instruction to the body. One type of apraxia affects speech. The brain has difficulty moving the lips, jaw, and tongue. And there are the symptoms of apraxia. The symptoms is less bubbling as a baby, appears to have difficulty moving the mouth for chewing, sucking and blowing, use body movements more often to communicate. For example, like extending your hand to ask for something or crying if you want to eat or drink, and it's hard to say the same word a second time. And how to overcome? speech therapy, music therapy, word games, and sign language. The third is dyslexia. Dyslexia is a learning disorder characterized by difficulty reading, writing, or spelling. People with dyslexia will find it difficult to identify spoken words and convert them into letters or sentences. And there are the symptoms too of dyslexia. The first is slower speech. Then children at his or her age, difficulty processing and understanding what is word, difficulty in spelling, writing, reading, and arithmetic. And how to overcome this? One of the most effective methods in improving the reading and writing ability of dyslexic patients is phonics. What is phonics? The phonics method focuses on improving the ability to identify and process sounds. And we go to the stuttering. Stuttering is a condition that interferes with a person's ability to speak. This condition is characterized by the repetition of syllables, sentences, sounds, or prolongations of the pronunciation of a word. Although it can be experienced by anyone, this condition is more common in children under 6 years of age. What are the symptoms? The symptoms of stuttering usually first appear when a child is in 18 until 24 months old. Difficulty starting words, phrases, or sentences, repetition of sounds, syllables, or words, and feeling anxious before speaking. And how to overcome this? This speech therapy aims to reduce speech disturbances and increase the patient's confidence. Speech therapy will focus on controlling symptoms of stuttering while speaking. And we go to dysgraphia. What is dysgraphia? Dysgraphia is a learning disability characterized by writing difficulties. Writing disorders include difficulty forming letters, spacing, spelling, and writing speed. In addition to producing handwriting that is difficult to read, people with dysgraphia tend to have difficulty choosing the words to use. And the symptoms are holding stationery awkwardly, poor fine motor coordination, inconsistent lettering. And how to overcome this? You can go to a child education psychologist or psychotherapist to help your child with dysgraphia. The therapist will perform a series of exercises to train the child's mind. We go to the Down syndrome. Down syndrome is a genetic disorder that causes sufferers to have low level of intelligence and a distinctive physical disorder. Down syndrome is a disease caused by chromosomal abnormalities, and Down syndrome is a genetic disorder that is quite common. And the causes of Down syndrome occurs when there is one extra copy of chromosome number 21. The chromosome of gene-forming structures are normally paired and are inherited from each parent. There are several risk factors for causing an extra copy of chromosome 21, including the mother being old enough to be pregnant or having other Down syndrome sufferer in the family. And how to overcome this? Psychotherapy, speech therapy, occupational therapy, and behavioral therapy. We go to the autism. Autism is a neurodevelopmental disorder that causes impaired behavior and social interaction. Symptoms of this disease are more often detected in childhood but can also be found in adulthood. Causes and symptoms of autism. The exact cause of autism is not known. However, there are risk factors that can increase the incidence of autism, such as gender, family history of autism, and premature birth. Behavioral disorders, such as doing the same movement over and over, for example, and always walking on tiptoes. How to overcome this? Autism cannot be cured. However, there are a number of methods that can be used so that people with autism can adjust to their daily lives, such as behavior and communication therapy, or taking medication to treat behaviors and mood disorders. The last is ADHD. Attention Deficit Hyperactivity Disorder is a mental disorder that causes a child to have difficulty paying attention and has impulsive and hyperactive behavior so that it can have an impact on children's achievement in school. Until now, the main cause of ADHD is not known with certainty. However, this condition is thought to be influenced by genetic and environmental factors. Besides occurring in children, ADHD can also occur in adults. What are the symptoms? The main symptoms of ADHD are difficulty paying attention, as well as impulsive and hyperactivity behavior. Patients cannot stay still and always want to move. People who have ADHD may also have learning difficulties such as difficult reading and writing. And how to overcome this? Handling ADHD can be in the form of medication and psychotherapy, and in addition to sufferers, parents, families, caregivers, and teachers at the schools also need to get guidance to deal with children with ADHD. Although ADHD cannot be completely cured, medication can relieve ADHD symptoms and enable the sufferer to lead a normal life. That's all from me. I hope you enjoy this video. Stay positive, stay healthy. Assalamualaikum warahmatullahi wabarakatuh.